Hello and welcome back to my channel. Today we're talking about long COVID, a condition that has affected millions of people worldwide following a COVID-19 infection. While most individuals recover from COVID-19 within a few weeks, some continue to experience lingering symptoms for months or even years. This is what's referred to as long COVID, also known as post-acute sequelae of SARS-CoV-2 infection, or PASC. Long COVID can affect multiple organ systems, leading to a wide range of symptoms that interfere with daily life. It can impact people who had severe infections, as well as those who only had mild or even asymptomatic cases. Understanding the symptoms, diagnostic process, and management of long COVID is crucial for those who are affected. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Long COVID presents with a wide range of symptoms that can vary significantly from person to person. Fatigue is one of the most common complaints, often described as exhaustion that does not improve with rest. This type of fatigue can be so severe that it interferes with basic daily activities, including work and exercise. Some individuals experience post-exertional malaise, where physical or mental effort leads to a worsening of symptoms for hours or days afterwards. Cognitive issues, often referred to as brain fog, are another hallmark of long COVID. People may have difficulty concentrating, remembering things, or processing information quickly. Some report feeling mentally sluggish, making it hard to perform tasks that were once routine. This can have a significant impact on work, school, and social interactions. Breathing difficulties are also common in long COVID. Some people continue to experience shortness of breath even after their initial infection has cleared. They may feel winded after mild exertion, such as walking up flights of stairs or even while resting. Persistent cough, chest tightness, and an increased heart rate can also occur, making daily activities more challenging. Many individuals with long COVID experience cardiovascular symptoms, including heart palpitations, dizziness, and episodes of rapid heart rate. Some develop postural orthostatic tachycardia syndrome, or POTS, a condition where standing up causes an abnormal increase in heart rate, leading to dizziness, fatigue, and even fainting. Other symptoms of long COVID include joint and muscle pain, sleep disturbances, headaches, and gastrointestinal problems such as nausea, diarrhea, or abdominal pain. Some individuals report changes in taste and smell that persist long after their infection has cleared. Mental health challenges, including anxiety and depression, are also common, as the prolonged nature of symptoms can be frustrating and life-altering. Diagnosing long COVID is complex because there is no single test that can confirm its presence. Instead, healthcare providers rely on a detailed medical history and a thorough evaluation of symptoms. Since long COVID can affect multiple organ systems, it is essential to rule out other conditions that might be responsible for persistent symptoms. A healthcare provider will typically begin by discussing the patient's history of COVID-19 infection, including when symptoms first appeared and whether they have persisted or fluctuated over time. They will also ask about any pre-existing health conditions that could contribute to ongoing symptoms. Laboratory tests may be ordered to assess overall health and check for underlying issues. Blood tests can evaluate markers of inflammation, organ function, and potential deficiencies such as low iron or vitamin levels. Some individuals may undergo imaging studies, such as chest x-rays or CT scans, if they have persistent respiratory symptoms. For those experiencing neurological or cognitive symptoms, cognitive function tests may be used to assess memory, attention, and processing speed. In cases where cardiovascular symptoms are present, tests like electrocardiograms or echocardiograms or tilt table tests may be performed to evaluate heart function and detect conditions like POTS. Because long COVID symptoms overlap with many other conditions, diagnosis often involves a process of exclusion. This means that if no other underlying medical explanation is found for the symptoms, long COVID may be diagnosed based on clinical history and persistent health problems following a COVID-19 infection. Managing long COVID focuses on relieving symptoms, improving quality of life, and helping individuals regain function. There is no universal cure for long COVID, so treatment is tailored to each person's specific symptoms and needs. Many individuals benefit from a multidisciplinary approach involving primary care providers, physical therapists, neurologists, cardiologists, and mental health professionals. One of the most important aspects of managing long COVID is pacing. Many individuals experience worsening symptoms when they push themselves too hard, especially those with post-exertional malaise. Learning to balance activity with adequate rest is essential to avoid symptom flare-ups. Some patients benefit from working with physical therapists who specialize in graded exercise therapy or rehabilitation programs tailored to long COVID. Fatigue management often involves lifestyle adjustments, such as establishing a consistent sleep schedule, prioritizing rest periods throughout the day, and avoiding activities that trigger excessive exhaustion. Cognitive symptoms like brain fog may improve with structured mental exercises, mindfulness techniques, and adequate hydration. For those with breathing difficulties, pulmonary rehabilitation programs can be helpful in retraining the lungs and improving oxygen intake. Breathing exercises, such as diaphragmatic breathing, can help manage breathlessness. Some individuals benefit from inhalers or other respiratory medications, especially if they have underlying lung conditions like asthma or COPD. Cardiovascular symptoms, such as rapid heart rate and dizziness, may be managed with lifestyle modifications, including increased salt and fluid intake, compression stockings, and avoiding prolonged standing. In some cases, medications such as beta blockers or fludrocortisone may be prescribed to help regulate heart rate and blood pressure. Pain management is another critical component of long COVID care. Over-the-counter pain relievers such as acetaminophen and nonsteroidal anti-inflammatory drugs, or NSAIDs, can be used for joint and muscle pain. Some individuals benefit from physical therapy, gentle stretching exercises, or alternative therapies like acupuncture. Mental health support is crucial for those struggling with anxiety, depression, or PTSD related to their illness. Therapy, counseling, and support groups can provide emotional support and coping strategies. Some individuals may require medications such as antidepressants or anti-anxiety medications to help manage mood disorders. Medications for long COVID are symptom-specific. In some cases, antihistamines have been explored for individuals with persistent inflammatory symptoms. Low-dose naltrexone has been studied for its potential benefits in reducing chronic inflammation and pain. Some antiviral medications are being investigated for their potential role in long COVID management, but more research is needed. I have found improvement in many symptoms of long COVID, including brain fog and fatigue with the medication bupropion. Because long COVID is a relatively new condition, research is ongoing and treatment recommendations continue to evolve. Some patients participate in clinical trials to explore potential new therapies. It is important for individuals with long COVID to work closely with their healthcare provider to find the best treatment plan for their unique symptoms. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, long COVID is a complex and often debilitating condition that can affect multiple organ systems and interfere with daily life. Symptoms can range from fatigue and brain fog to respiratory issues, cardiovascular problems, and chronic pain. Diagnosing long COVID requires a thorough medical evaluation, as there is no single test to confirm its presence. Healthcare providers rely on a patient history, symptom assessment, and diagnostic testing to rule out other conditions. Management focuses on relieving symptoms and improving function through a combination of lifestyle modifications, rehabilitation, and medications tailored to individual needs. While there is no cure for long COVID at this time, ongoing research continues to explore new treatment options. If you or someone you know is struggling with persistent symptoms after a COVID-19 infection, it is important to seek medical attention. Working with a healthcare provider can help identify the best strategies for symptom management and improving quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.